So access to healthcare is one of the biggest issues facing humanity right now. Although we have made great progress, still access to healthcare, timely and reliable access is always a problem. Now, that's a problem not only in developing countries, but also in developed countries. But right now, we are heading towards one of the most underdeveloped portions of Punjab, a province in Pakistan. Now, this area is relatively connected. It does have some internet connectivity, does have electricity in most places. However, this is an ideal scenario to launch a project to connect the poor, to connect the needy with physicians on the outside. Now what happens is, as you can see, we have to drive fairly slow. The roads are not great. Facilities are minimal. However, this is where a lot of people do live, and they do suffer a lot if they do have any medical problems. Anything such as a migraine, a bronchitis, a urinary tract infection can surely bring them down easily and quickly, and they won't know what hit them. So our goal is to try to introduce a system where they will be able to connect remotely with providers, and who can at least guide them as what is the next step. They can surely find pharmacies, they can surely be able to collect medication if somebody is able to recommend and prescribe appropriately based on the situation. So this is the aim of our visit, visiting this area. This is PDCon, and we will surely keep you updated. Thank you so much. So we're still on the drive, and just want to show you some of the scenery around this area. I don't know if you can appreciate, but that is a salt range, and this salt range actually was basically discovered by Alexander the Great when his horses were crossing by this area, and they were actually licking the ground. And why they were licking the ground? Because the ground was so salty. Now this area actually has one of the biggest salt ranges in the world within these mountains. So actually salt is exported from here to all over the world. All of the salt lamps that you find in stores all over the world, a lot of them actually come from this salt mountain range. Anyways, so you can see this area is pretty remote, and as I was mentioning, people do have to travel long distances, 3, 4, 5 hours just to get to any health center. So we're trying to bridge this gap and bring this facility over to the people so they can stop worrying about healthcare issues when they do come, and we can find the disease, and if needed, we can guide them in the right direction to yes, you definitely do need to get to a bigger center or a city or a bigger hospital. All right, thank you so much. Ladies and gentlemen, we had an excellent time here, and we will be introducing modalities for patient access with physicians at their doorstep, and this will be helping out people who are the most destitute, people who basically have to travel 4 or 5 hours to seek any help, people who are otherwise reluctant. We will introduce this basically at the grassroots level to help these individuals. Anyways, this is the initiation, and let's pray and keep it moving forward. Thank you so much. Bye bye.